morning. Welcome to the community briefing. My name is Gregory Sneed. Today is the 28th? Yeah, 28th of May, 2026. Today seems like it's already 4 p.m. That's how busy this day's been just already. And I was telling, I have to head down to Orange County. I got to be there by 2. So I'll be jetting out here pretty promptly. But my name is Gregory Sneed, President, CEO of Lifesaver Financial Services. You're here for the community briefing. We've got a great show for you today. So sit back and relax and participate. And now it's my pleasure to welcome to the virtual stage the Queen, the last time in May of 2026, the Queen of our community briefing, Miss Crystal Mitchell.
Welcome, everyone. Glad to have you to the community briefing. And yes, Miss Sharon, this is your home, so you are welcome anytime. We are always thrilled to have you, and we've been to your home as well, and we had a fantastic time there also. My name is Crystal Mitchell. I'm the co-director of Recycling Black Dollars, as well as I have my own business practice, Mitchell's Business Solution. I'm a business coach and consultant for many of the organizations in the city, as well as I teach children how to become entrepreneurs. And I must say, my kids took first, second, and third place in the city final entrepreneur program, AEP program, that is funded by Union Bank. So, of course, I am just ecstatic. And I have a young lady tomorrow that's going to be participating in the regional. So we're going to give her a prayer, because I would love for her to go to national, which would be in New York. And then for all of you, I have Biz Camp starting June 22nd. So if you have any young people between the ages of 13 and 18, we would love to have them this summer, and it starts June 22nd and it ends on the 10th of July. This platform is inspiration during the pandemic to make sure we had a source and a place that we could all come together to introduce you to our leaders and stakeholders, those people out here that got boots on the ground and that are doing incredible things for our community. But not everybody knows that that's happening, nor do not everyone know who they are. So we want to make sure that the Main Street knows who the worker bees are and how to reach them. So that's why this platform exists. We are powered and sponsored by Recycling Black Dollars and the BBA, Ms. Sarah Harris. I'm sure she'll pop in shortly. And we are monetarily sponsored by Los Angeles LDC, Southern California Edison, PCR, Wells Fargo Bank, and SoCal Gas, and Urban Excellence. And we want to thank them so much for their support. Anyone else that wants to support, we welcome everyone. Hello to all of our guests that are here all the time. So hello, everybody, our regulars. And thank you guys for joining us. And we have a fantastic team. You've met Greg. Ms. Robin Billups is on a plane about to land in Chicago, but she will be popping in shortly. And Mr. Stephen Turner, I saw him pop. He called me, so I guess he's coming in soon. And without him, he's our producer. Without him, man, I don't know how y'all would be contacted, because all the rest of us are so incredibly crazy busy. So we definitely appreciate Stephen, and we are glad to have all of you here. And with that, I'm going to kick it back over. Oh, wait, I got to speak for Robin. Vote, 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 vote. June 2nd is the day, and that's what our guest is going to be here to talk about. This is, I think this is the most important election that I think I've ever voted in my since I've been 18 years old. That's a long time ago. It's imperative that we protect the state of California. That's all I'm going to say. You guys can take it, go with however you want to go with it, but we need to protect the state of California. With that, Mr. Greg Sneed, it's over to you.
Thank you. Okay, so let's see. Crystal, do I have my weeks mixed up? Is Joseph our guest today?
No, Sharon is our guest.
That's why did I have Joseph? That's
no, Joseph next week. He's
next week.
Yeah.
Okay. So Sharon here is our guest. I'm like, wait a minute. I got Joseph's bio here.
Yeah. Sharon today.
I don't know what year is this.
I don't know. It's a long time.
I was telling Crystal I was going through this process yesterday. It was kind of brain draining. I'm creating a new PowerPoint presentation, and I was on in a session with Chat GPT for 5.5 hours, going back and forth. And after that, I was just kind of drained. So, so Sharon, I don't have your bio pulled up. So today you're going to be self introducing yourself. Because I was Miss. I got a week ahead of myself. So,
No, no
um,
problem. Happy to do it.
all
I
right.
mean, me
He's
and me
So,
and
ready
Joseph,
anyway.
Joseph, if you want to come co-host, since you're already a week ahead of the game. But I'll backtrack in again and just share gratitude. I wanted to just say thank you to Greg and Crystal and Stephen and Robin for allowing MLK Community Healthcare to be on this platform with you. This is the third time that MLKCH has been invited to share out. It's great to see you all, and I love that this community briefing continues to just thrive year after year, week after week. And I know it's not easy. So today, I'm representing MLK Community Healthcare. I serve as their director of major gifts, which it just basically means that my job is to help steward resources to our wonderful healthcare system. And part of that role is also working with our volunteer leaders. And Robin Billups has been one of the founding members of what we call the Dream Council. And it's a group of about 15 members of community leaders. And their task really is to help raise awareness and funding for our hospital. So today I'm joined by my colleague, Dr. Atul Nakasi, and I see Tony Weiss here, who's our Director of Media Relations. And today what I wanted to do was just give just an overview about MLKCH for folks who may not be aware of who we are, what we do, and then really turn it over to Dr. Nakasi to share about our work with our agencies to help influence policy, and that's where Measure ER comes in as well. So speaking of Measure ER, I'm sure you've seen flyers or got text messages, seen the ads, and hopefully you've already voted. And if not, we have until June 2nd, and we have time to spread the good word until then. But first, a little bit about MLK Community Healthcare. We are a safety net healthcare system, and we are in South LA, specifically in the Watts Willowbrook area. We have been around since 2015. And for folks who are longtime Angelinos, you might remember that MLKCH stands on the site of the former King Drew Medical Center. And that medical center closed in 2007 because of patient neglect, systemic mismanagement. And so for about 8 years, there was no hospital in the area. And the main difference between MLKCH and the former hospital is that we are a private-public partnership. So we are on county land, but our leadership is private, and that has allowed us to be very nimble and very responsive to what the community needs. And we've been able to grow and accelerate our programs at a much faster rate than if we were constrained by county guidelines. I just want to highlight some of the great things that we've done in just 10 years. We have a 131 bed hospital. We have an emergency department that is really heavily impacted. Originally we were built to see 40,000 patients a year, and we routinely see about 120,000 a year. And that translates daily to about 350 to 400 patients in our ED every day. We have a medical group. And we have a range of community programs that include street medicine, where we have teams deployed out every day out into the community where we see patients where they are, whether they're in an encampment or on the streets or in motels, temporary housing. Right now, we have 3 teams in place, and that program has been wonderful. It's been supported by Philanthropy, but is now supported through insurance plans. So it's something that we can sustain. As part of that street medicine team, we've included social workers and psychiatric nurses as part of the team that goes out to the community. And part of the work there is to help bring our patients into the MLK Community Healthcare family so they can still they can still get regular healthcare even though they're currently unhoused. We offer a diabetes care program that has recently had great success in proving that we can prevent amputations. And just 3 years ago, amputations were the most common surgery at our hospital. So our diabetes program now proves that we can virtually eliminate amputations. Important for our moms in South LA with the closure, as you might know, Centinela Medical Center no longer has a maternity unit. Neither does Gardena Memorial. So MLK really is the only nonprofit hospital in the area that continues to offer maternity care. And lastly, I'm really proud to share that we have a very robust set of training programs for our nurses and physicians because we believe that we want to offer care for our community, but we also need to look ahead and start training clinicians and educators to want to continue working in our community. So we have training programs for nurses, whether you're a new graduate coming right out of school to a career nurse that has 20 years of experience. We have avenues where you can continue your training at MLK with the hope that you continue to stay with us. And this Friday, we will graduate our second class of resident physicians in our graduate medical education program. We have 15 physicians now that are training, and I'm happy to say that they're all from communities like ours. They're all physicians of color. Our first graduating class, 3 out of the 5 continue to work with us. And so that to us is a measure of success that we're seeing physicians that are training here and that they want to continue working here after they graduate. So that is a lot, just an overview. But before I launch into Dr. Nakasi's presentation here, I want to see if there are any just questions about the hospital or anything I've mentioned so far.
Well, the one thing I will do is rewind and give you your proper introduction. Sharon is the director of major gifts at the MLK Community Health Care, and she's been there now 4 years. I think 4 years exactly. And before that, director of major and planned gifts at the Library Foundation of Los Angeles, the director of development and chief development officer at Puente Learning Center, and also spent time with the California Science Center. She is a graduate of UCLA, and there you go Bruins. And I don't remember from the last time, where did you grow up? Did you grow up here in Los Angeles? Are you a native of LA?
No, I'm not. I grew up in Hawaii. I grew up in Pearl City, Hawaii, which is on Oahu.
Yeah.
But I feel I've lived in LA longer than I was in Hawaii, so I consider both,
Both home.
born and
Okay.
raised there, but grown in LA.
And the last question I have before we bring up is you guys do a wonderful job in fundraising and the Dream Show. And the Dream Show is fabulous. I don't know if there is an abbreviated or a highlight version of it because it's about an hour. But that is it's a wonderful production that highlights really the services and the people. Just wonderful stories of what you guys bring to the community and the difference that it makes for those individuals. So bravo to you guys in doing the work and then also in that production. So now you'd like to bring to our virtual stage
Dr. Nakasi.
Dr. Nakasi. Welcome, Dr. Nakasi.
Thank you, Greg and Crystal, and appreciate the chance to be here. And thank you, Sharon, so much for that overview of MLK Community Healthcare. Really, I wanted to be able to dive into Measure ER. I think my takeaways really, and happy to have a conversation around this, is Measure ER is the most important healthcare initiative on the ballot next week. MLKCH has been in financial distress for several years, and Measure ER is the most critical, vital lifeline to sustaining this hospital and keeping our doors open. That's the bottom line of really what is at stake with Measure ER. And I'll dive into that to why is it so vital to us? Why have we been in distress? And why is it really important that voters in all of LA County have accurate information about this ballot measure when they're casting their votes? With that, I'll have Tony load up our brief presentation, which really illustrates a lot of these important points that I had just shared. And just as background as we're doing that, I'm a practicing primary care doctor in our East Compton clinic. So I see patients on Fridays in our community clinic associated with the hospital, and really have been on the ground practicing for the last 7 to 10 years. And so I see firsthand how challenging it is to navigate the health system, how challenging it is to get affordable, high quality healthcare, and how much need there is in our community for high quality, accessible medical services. And we all know what that means because this community had suffered the setback of a gaping hole in South LA when the old King Drew closed. So we know very personally, near and dear to our hearts, what it means when we lose a hospital, what it means when we lose access, what it means when we don't have high quality medical care. And that's at stake with Measure ER providing vital funding for the safety net health system. And so we can move to the next slide here, Tony. Our community, our hospital is highly dependent, our hospital and our patients, on public insurance and government supported insurance programs. So 8 in 10 of our patients rely on Medicaid. That's the blue you see here, 8 in 10. That's the government, federal and state government insurance program for the low income. 8 in our 10 patients are enrolled in Medicaid. Medicare, which is for seniors, that's about 11%. And uninsured, that's about 8% of our patients. Only 3% of our patients have commercial insurance. 97% are reliant on public insurance or are uninsured. We can move to the next slide. This is really important because if you see this third graph, the magenta, Greg and Crystal and members here today, it costs about $800 on average for us, our hospital, to provide care for you when you come to our emergency department, about $800 on average. But look at the orange graph. That's what we get from Medi-Cal, the Medicaid program of California for the low income. Low income insurance pays us about $250 for an $800 visit. You can quickly do the math here. That's unsustainable. No business in America could stay open if their costs are more than double what they attain in revenue. And so we have very little commercial revenue in green. Most hospitals, they're able to stay afloat because they have enough green commercial revenue, which pays $2,000 for an $800 cost visit. This is our MLKCH data of what insurance pays our hospital. And so they're able to stay afloat and provide care to the low income because they have enough cushion in their revenue from commercial insurance. We don't have that luxury. MLKCH does not have the luxury of those cushions because only 3% of our patients are insured by commercial insurance. If you go to the next slide, this becomes really apparent when we look at the number of Medi-Cal, the Medicaid program of California, the number of Medi-Cal patients we see in our emergency department is number 1 in the whole state of California. Out of all 315 hospitals, we see more Medi-Cal emergency department visits than any hospital in the state, about 84,000. So we can quickly do the math. If it costs $800 to see a patient and we're getting $250 and we have 84,000 of those visits, the math doesn't add up. And it leads to financial distress, which is the situation the hospital has been into because there is such need and there is such high volume that comes through our emergency department to meet the needs of South LA and Watts, Willowbrook, and Compton and the surrounding areas. We can move to the next slide, Tony. Because the insurance revenues come to us at such a low level compared to what it costs us, they only make up less than half of our budget. That's the yellow here in this pie graph. Less than half of our budget and our funding comes from insurance. We are reliant on government supplements, extra supplemental payments, the blue and the orange, to stay afloat. More than half of our budget are extra supplements necessary to provide the care to our community. We can move to the next slide. Because of this, the hospitals also, in addition to all of this, our costs have gone up. We all know this personally. Look at gas prices right now. Look at affordability. Look at rent. Look at the cost of everything around us. That same situation has happened to the hospital. For the last 10 years, inflation and our prices have gone up 33%. 33%. That's wages. That's drugs and pharmaceuticals. That's IV fluids. That's the CT scanners. That's the lights of the hospital. Everything it takes to keep a hospital going, our prices have gone up by 33% over the last 10 years. So we are feeling the pinch. We can move to the next slide. Because of all of that, low reimbursements, escalating costs, high volumes, the hospital has been functionally in the red at the last 4 years in a row. The only reason we were in the green last year was because we had a bailout, an emergency bailout from LA County Board of Supervisors that got us barely in the green. Without that bailout, we've been running in the red with negative margins 4 years in a row. We can move to the next slide. HR 1, which was now passed by Congress and the president last year, signed into law. Everything I shared with you is part one of our story. This was all before HR 1 was passed into law last year by Congress and the president. That sought to cut $1 trillion from Medicaid over the next 10 years across the country. Because what HR 1 did is it said, we're going to give $3 trillion in tax cuts to the top 50% of the country. And to fund those tax cuts, we are going to take $1 trillion from Medi-Cal and the Medicaid program across the country. And so that is what has now been implemented across the country, and as a direct effect on the hospital is that the cuts to Medi-Cal. We can move to the next slide. What does that mean for LA County? So up to 1.1 million Angelenos could lose their health insurance. 1.1 million Angelenos. These are people we know, our friends, our family, our neighbors, our parents, people who depend on Medi-Cal for their health insurance. Our hospital faces an 80 to 100 million funding gap due to HR 1 starting next year, $80 to $100 million hole. More patients will become uninsured. They will seek care later. They will seek care when they are sicker and when they have more advanced diseases and when it costs more because they're sicker to care for to the system. And already we've seen LA County's public health department close 7 out of 13 public health clinics. They've already closed half of their clinics. Half of the clinics are gone from the public health department. Those are clinics that provided vital services for testing for tuberculosis, for syphilis, for sexually transmitted infections, public health measures, vaccinations, preventative care. Already, because of federal cuts, we've lost half of the county's public health clinics, the clinical services provided there, including 2 in the South LA area of Inglewood and South Los Angeles. So we can move to the next slide. So what does Measure ER do? Measure ER was supported and sponsored by Supervisor Holly Mitchell and Hilda Solis at the Board of Supervisors meeting in February to put it on the ballot. It passed 4-1 on the Board of Supervisors to move the measure onto the ballot for voters to decide. And that is the decision that is that faces voters here today in LA County, that decision on Measure ER. People can vote now. People have been mailed ballots if you're a registered voter. If you're not registered, you can still cast your vote as a provisional ballot and it will get counted and verified. We can move to the next slide. It will require a majority vote to pass. So what is Measure ER? Measure ER is a community investment. It is a vital community investment of a half a penny per dollar sales tax for LA County. That means for every $100 you spend, it is an additional 50 cents. So it's an extra 50 cents for every $100 spent temporarily for 5 years. If it passes in June, it takes effect in October of 26 for 5 Octobers, and it automatically expires October of 2031. And then the tax is automatically expired and repealed. So it is a temporary measure, 50 cents for every $100 you spend. It exempts groceries. No sales tax on groceries, no sales tax on medical prescriptions or medical equipment and supplies. It is automatically expiring, and there is an independent citizens oversight committee that will oversee how the funds are spent for accountability, including independent audit reviews that will be conducted of the funds. And it will last 5 years and anticipated to generate approximately $1 billion in revenue dedicated to supporting the safety net system, the clinics and the hospitals Medi-Cal patients rely on. We can move to the next slide. This is the exact distribution. About 45% will go to 450 community clinics that care for low-income and uninsured patients. About 22% will go to the 4 county safety net hospitals, Olive View, UCLA, Harbor, UCLA, Rancho Los Amigos, LA General, and the 27 clinics that are run by the County of Los Angeles and the Department of Health Services. 10% will go to the county public health departments again, to support vaccinations, disease tracking, and outbreak response, disaster preparedness, infection, disease testing, prevention, and treatment. And 5% will go to nonprofit safety nets, including MLK-CH. There are also additional allocations, 5% to reproductive health services, including Planned Parenthood, money as well for school-based health, as well as social services like the IHSS program, which provides funding so loved ones can help care for their family members so that they don't have to be institutionalized in a nursing home or a adult living facility and can continue to be cared for at home by helping support economically caregivers who care for their family members. So that's where the funding will be distributed. We can move to the next slide. And then just to wrap up, and then happy to have a conversation here. For us, that 5% will amount to a significant amount of closing our funding gap of 80 to $100 million. We believe, based on the language passed by the Board of Supervisors in February, we will be eligible for a large portion, tens of millions of dollars out of that $50 million allocation to safety net hospitals. And this would be vital funding for the hospital close this gap that I had discussed earlier. We can move to the next slide. And then just to conclude, there are ways we can all get involved. Ballots, you can find a ballot drop-off site near your home or your community at this QR code. You can also find a voting center if you prefer to vote in person. Satellite voting stations are already up and running across the county of LA. So you can vote right now in person. You can vote by mailing your ballot back. You can vote by dropping your ballot in a drop box, or you can vote in person on Tuesday. So please, this is an opportunity to use your voice. Make sure you're heard on the most critical healthcare measure on the June ballot. We can move to the last slide. And what can we all do to help get the word out? We can talk to our family members and friends. You can learn more at mlkch.org/measure-ER, mlkch.org/measure-ER. You can share information via social media, email, text. You can host a briefing. We are very, very happy to come and speak to your organization, to hold a 15-minute briefing on this measure to help educate people. Our number one goal is to help educate and inform the community of what's at stake and what this measure intends to do. And with that, happy to answer questions and have a conversation about Measure ER. Thank you.
Quick question. How is it tracking? Obviously, there's some pros and cons. A sales tax increase on its surface is always a challenge for a lot of our voters. Same thing when you're floating bonds. And so how is it tracking so far? Is the public opinion really supported? Is it 50-50? Or, where do we stand right now?
Yeah, it's a good question, Greg. The latest polling I've seen is this is a dead heat. I've seen 48% in support, 45% against. I've seen 47% against, 45% support. I would call that a statistical dead heat. It's within the margin of error, which reemphasizes why every single vote is so critical. And I will say the latest ballot returns today, if you look at them, only 10% of the 4 million ballots mailed out have been returned. Only 10% as of today. So every voice will count. It's trending towards more a lower voter turnout. We'll see what the returns ultimately show on Tuesday, but this is a dead heat based on the latest polling.
And if I could add,
I haven't dropped mine off yet. I'm dropping it off today. I think Crystal said she was doing the same. So, so we haven't registered yet. Yeah.
It was a tough ballot to go through, though. So confusing, and everyone knows how important it is to do it. And so we had a young lady that we spoke with after the show last week, and she said it had her it was so intense and stressful. She was procrastinating because she had so many questions. And so we actually answered as many as we could answer last week. And so she was able to fill out her ballot. So I don't think we do normally, Greg always talks about the low outpour of people. But I think this one was pretty darn intense because we do know how serious it is. I think before you guys jumped on, I think I'm pretty savvy at this stuff. And every year I do my intensive search, but you know, 5 pages, and two of them are dedicated to governor and mayor with 90,000 people. We all should have actually got on the ballot, man, because everybody appeared in Los Angeles got on the ballot. And so I think that could be a lot. So we've been trying to push it here. I know my family is a mandatory thing here, so I'm taking ballots over to Norwalk today. This is one of those that I find to be very important. So I need to get it to the county coroner, reporter's office. So I think that's been some of it. Atul, is that this one's overwhelming, and most people are terrified as to what can happen to our state based upon what we've seen across the state. And I think that's some of the pushback. Tony, I know you had something to say.
Sure. I mean, those are all great points. A couple things worth noting is one, the latest poll that the Measure ER campaign conducted, they said that the biggest thing that holds it back is just people not really knowing about the measure or knowing what it does. And so that's a huge thing. As you say, people are already intimidated by the ballot. And I think also with the amount of ads that are going on in the coverage, I think a lot of the things can feel a little distant, a little bit like, food fights between politicians. And obviously we know that stuff matters, but I think people don't understand that there are things on the ballot like ER that are going to have a very direct impact on their quality of life in their community. And then the other thing I just want to add is that there's been a lot of political observers who've said that voters are holding back their ballots late, even more so than usual, and especially Democratic voters, in part because of confusion about the governor's race and so forth. And so there's a lot of people who are open to being impacted, and we know, like, for people who are a little less politically involved, that procrastination can easily tip over into not getting it in. So if we can just make that little extra push, give people that little extra nudge, and let them know how much their vote is really going to count for their neighbors and their community, I think that can really make a difference. And we still have the time to make that difference. They have
Yeah,
not.
exactly. There's some ballots, elections where I wouldn't say it's a slam dunk, but you're just like, yeah, you fill it out real quick. And this is not one of them. This is one where you really have to take some time. There were a lot of judges on and prior to maybe about 10 years ago, I would say, it was just, I covered my eyes. I just circled boxes and didn't know who I was voting for on the judge, because they don't, there's no advertising there. And a lot of times you'll see an existing judge and somebody with they're maybe an attorney or something, but they have nothing to do with the courts, and they're running. You say, okay, well that's easy. A little more challenging when you have two judges running against each other, but that had some complexity to it. So because Chris and I, we normally go through this piece of cake, and we were talking several times. It's like, question for you. So to what extent does this get exacerbated by federal cuts? Does MLK Community Center receive federal funding? And based on the current occupants at 1,600, has that impacted you guys as well? How does that work?
Yeah, it's a great question, Greg. We are very reliant on federal and state funding through the Medi-Cal program. So I'll give a very concrete example. We have about $75 million. That's just one set of supplements. We have a few different supplements, those extra payments to keep our doors open. One of them, 75 million, that was directly impacted by HR 1, the federal law passed last year, and it caps it, it restricts it and cuts it, the amount of that funding. And so, yes, we're in the crosshairs. I often say we are ground zero when it comes to Medi-Cal's impacts from HR 1, which is why really this measure was proposed as, what do we have agency on? What do we have the power locally to do in the setting of these cuts? And that's what really brought about this measure from Holly Mitchell and Hilda Solis on the Board of Supervisors, that now will go in front of voters.
So in some ways, it shifts it from the federal government to the LA County taxpayers.
It is. It's a shift in responsibility. And we can just name it as it is. We can just call that unfair. we can call that unfair. Many people will feel that, right? We look at the prices of everything. No one wants to be taxed more, right? It's what will that tax do? What is that investment and that benefit of that tax to help our family, our friends? 1 in 3 Angelinos relies on Medi-Cal.
Yeah.
1 in 3. And so I'm with you. That responsibility, it is a shift. We hope it is a temporary shift, right? That's why it automatically expires, because we do need the federal government and the state government to help support local Angelinos. And Medi-Cal is a state and federal government program. And so that's really what should help bolster and support the program. But in the situation we're facing now, this was the opportunity presented where we could have agency in our own fate.
Are patients 65 and up then covered by Medicare through federal, or does it? But that's not the
through Medicare. But if you're a low income senior, you could be covered by both. You may have both the Medi-Cal insurance and the Medicare insurance and still be impacted because you have both coverage, and both programs cover a little bit different things in different ways. For example, so low income seniors also impacted.
Yeah. Because and depending on your health coverage period, because some of them are not equal out there. So especially in that thing, it's interesting with all of this, especially the ones that are running for mayor, other than the incumbent and governor, and he's leaving. I have not heard not one of them say how important Measure ER was. And that's huge, right? Because this is the state that they're wanting to govern, or the city that they want to govern. You would think that in their propaganda thing and spending millions and millions and millions and millions and millions of dollars to this office or running for this office, that one is kind of nonpartisan. It's about the people. And so why was that not included in what we're going to do for the city, what we're going to do for the state, right? So, and those are the things that I was looking for. And I think that is why a lot of people have been hesitant in or procrastinating, because, each one of the candidates that are running to run our city and our state, we're a very diverse state. And it's really important that the right person is in there and that they care about all of us, not just one grouping of us, and that all of the needs that we have is taken care of. We have a large population of seniors that are low income just because it's just the nature of what's happening. The pension plans have been reduced. Their retirement plans have been slashed in half with all the political nonsense going on. And so, and that's our most vulnerable population. Our children and our elders are our most vulnerable population when it comes to healthcare, because they both have greater needs. And those were the things I was looking for to hear from people talking about, not just what they were going to do for the budget. I wanted to hear what you were going to do for the people, and that was some of the stuff that was really hindering just filling out that ballot and sending it out early on for me. I don't know about the rest of you guys, but that was some of my thing. I just was not hearing the overall complexity of all of the people in this country, in this state, being taken into consideration.
Are there any other counties in the state of California that are doing something similar?
Yeah, Greg, it's a great question. So Santa Clara County passed the sales tax successfully in November. To fund about $300 million in new revenue to support the safety net clinics and hospitals and coverage for those on Medi-Cal. There's another county also that's proposing one now, also along with LA County. So multiple counties are looking at ways to help support their residents and keep the clinics, hospitals, emergency departments open for their residents. And, South LA, as I shared up front, Greg, you know this very well, and Crystal, what it meant when we lost the hospital, in South LA, and the 8 years we went without it. And researchers studied what happened to the community. They saw three findings when we lost the hospital. One is there was worse access to care, to primary care and specialty care. Patients couldn't get to the clinic visits and access they needed to their doctors. They had higher chance of dying The chance of dying from a gunshot wound increased when there was no Old King Drew. And other hospitals got inundated with all of the trauma admissions and uninsured patients that King Drew was providing care for, vital care for in the community. So we kind of know the ripple effects when a hospital closes. And I'll tell you, when a hospital closes, it's really, really hard for it to come back. We were lucky. We were lucky there were the investments from the LA County Board of Supervisors, and we had champions for South LA advocating for the hospital. So other counties are looking at measures to support and protect that access too.
Now, do neighboring hospitals chip in or support this? You're saving them a ton of money. So
Yep. So the Hospital Association of Southern California is supporting it. They represent 170 hospitals in Southern California. They're supporting the measure. And then the doctors are supporting it. The LA County Medical Association also is supporting it. So yes, you're completely right. When Old King Drew was gone, the neighboring hospitals, Downey, Long Beach, right, west and north of the hospital, Inglewood, where Sentinel and Gardena Memorial are, or north, up towards Crenshaw, right? We were all impacted, with those ripple effects in those hospitals. So you're right. And we've heard that from hospitals. There were hospitals that vividly remember what happened to their own hospitals when King Drew closed, and all the patients they got overflown with in their emergency rooms, the long wait times, the patients who then had to go elsewhere.
Yeah, I can see that happening. It's interesting. Oh, hold on one second, Greg. The other measures that are on there, and I'm sure that confused some folks also, because every last one of those measures actually is a takeaway from one and throw the onus onto the consumer. Because all of those, the travel one, everyone, who's going to end up paying for that is us, right? The cannabis one is us. And so those are the things that you that's why you had to study it so much. But yeah, and the pandemic hurt everybody. I mean, every hospital out there, because you couldn't turn any people away. And so they all took the hit for that. So trying to recover from that and take away Medicare or reduce Medicare and Medi-Cal benefits from the federal level, it's something else. So,
Crystal, that's a really important point you make. MLKCH, that chart I showed earlier, we were in the green years and years and years, right? Since we opened, it was the pandemic that depleted our safety net. We're the safety net for the community. We had a safety net too of cash reserves, all gone because we had to. We had to care for the patients. We had to help save your life if you're infected with COVID, pneumonia, and the ICU with a ventilator.
Right.
We were going to do everything we needed to save your life. And so we spent all our cash down because that was the right thing to do, to care for the community during the worst pandemic of the last century. But we're still recovering from that. Our cash reserves are depleted at this point for the hospital. And it's why we've needed the state legislature and the Board of Supervisors to give us 4 emergency bailouts. In the last 36 months, we've needed 4 bailouts to keep the hospital open. So, this is, you're completely right. The pandemic had a big bearing on us and hospitals like us.
Exactly.
Tony, I don't know if you wanted to share anything more on any of these questions.
No, I mean, I feel like you've covered it. I mean, one of the things that's complex about sharing this story is that MLKCH, simultaneously, there were structural challenges in running a safety net hospital that preceded HR1. And now, as we were talking about with the Medicaid payments and so forth, and now HR1 just layers a whole new set of challenges on top of that. And so, what HR1 is, and one of the things that, it's important to convey to people, because people have rightly said, this is a real burden on households to have sales tax added to them. And, and the poorer your household is, the more you feel that. And it's not fair. And the flip side is that, we essentially have to keep just the infrastructure of our safety net together, at least for a few years, until we can get responsible governance back at the federal level. And in the meantime, we have to take on this burden ourselves, unfair as it is, just to make sure that, we can keep people well enough to keep going to work and support businesses, that we can keep people well enough to have at least a decent quality of life. All these things that our safety net provides. And if we're not able to pass this, if things do start to fall apart, it's much harder to reopen a clinic or especially a hospital once it closes than to keep it open in the first place. And
Can you do
that's down. Go ahead, please, please.
a quick summary on what was or what did HR1 do? What is that the one that started earlier this year or
It
January?
so it passed in summer, I think June or beginning of July of last year. It did a couple things. It passed massive tax cuts aimed at corporations and wealthy individuals. And then part of the way of quote unquote paying for those tax cuts was to make huge cuts elsewhere to our safety net. And so part of that was $1 trillion out of Medicaid, out of, over the next 10 years. There were cuts to public health and so forth. And then one thing that they did is that the Medicaid cuts, and perhaps there was political logic behind this, we haven't fully felt them yet. They're really going to kick in at the beginning of next year. So right now we're in the preparatory stage. We know we're heading towards that fiscal cliff, but it hasn't happened. But once next year comes in, a lot of people are going to be kicked off the Medicaid rolls as a result of documentation status, as a result of heavy new administrative burdens to recertify every 6 months about what your status is and so forth. And the net effect is just a lot of people are going to lose that care. And it's already happening. LA County is losing 1,000 people from our Medicaid rolls every single day. Because the other thing is that HR1 combined with the impact of the federal immigration raids, and they made people understandably very scared. And so there are a lot of people who, are reluctant now to sort of submit their information to any kind of government entity. And as a result, they're dropping off. And because of new restrictions, if you were previously undocumented and receiving some kind of Medicaid, Medi-Cal, you can't get back on now. Once you're off, you can't get back on. And so the big impact, the big hole is going to open up next year, but we're already starting to see signs of that. And already there are more people who are vulnerable because of that situation.
There's a question here about hospitals and clinics in rural areas closing. Is this the same reimbursement issues that you were talking about here?
Partly, yes. I mean, running a hospital in a rural area is already difficult. Yes, they do have significant amounts of Medicaid patients. The one thing that the rural hospitals have going for them, so Medicaid, the HR1 is going to cut. There included a $50 billion fund to support rural hospitals, because that was who the writers of the bill felt that they wanted to support. However, rural hospitals are losing $150 billion as a result of HR1. So it's really not going to be enough. So in addition to the pre-existing challenges of rural hospitals, which in some ways overlap with what we laid out, Medicaid reimbursement rates and so forth, they're now facing even bigger cuts. And so that's part of why we're seeing closures there. And they're preparing for the big wave that they know is coming. And just like the urban safety net hospitals, once it hits, we're going to be seeing a lot more cuts, and it's going to be in urban areas and it's going to be in rural areas. It's because it's healthcare. Everybody's connected at the end of the day.
Yeah. I also think that I think Tony mentioned it, until we have intelligent governance coming from DC, we're vulnerable to another pandemic or an Ebola breakout. My understanding is there's no assistant going into Africa to help with that. But if you don't control it from the point, then you don't know whether you got it into you go on a cruise or on a plane, and then it comes back to the country, to us. And so we're dealing with this like we did the pandemic in the beginning. So that also brings out what happens over the next 6 months. We're not even going to say 2 years, next 6 months, if next 30 days, let's just put it like it really is. The next 30 days, we could be in that situation as well. So I do believe this is very important. I have just blasted it out on all of our networks. I would like to ask all of our guests, if you all have social media pages, if you would do it. I will put the link that I just populated in the chat. And if you just take it and share it, I mean, that's the best. That's what we can do. And also, if you haven't voted, I hope this has been some clarity, helping you understand the importance, because it's not just us, guys. We live in a country, where, in a city, in a state, that we all interact with each other. and our power of us all reaching out to the people that we know and asking them to do this for us is really important. We all we have family members that fit these categories, and hell, we may be in these categories at some point, and so we need to make sure we have assistance. So if I can ask you all to do that. And then for Sharon and Atul and Tony, we welcome you guys to come back, whatever you need, because I think this is an important topic, and that's the point of the community briefing. If you guys have something that you need shared, you don't have to wait for us to reach out. You don't even have to make an appointment. We don't have to get you on the calendar. You just pop in and come in, and we'll make room. You'll be our advocates for healthcare and for the people that are in that area. We have quite a few individuals that just pop in and say, hey, we got something we'd like to share, or we need to get on and be able to have this conversation. And then we'll make sure the show gets blasted out. I'll make sure I know I'm back a couple of episodes, but I'll make sure I get this one edited and ready to go out and get it over to you guys. There's been a couple of conversations when you were speaking. I'll even do some clips. And if you want, I can send that to you guys as well. And before everyone gets to the polls on the 2nd. And then, of course, we still got to fight as we go forward to November. So, this is your platform. That's the purpose of the community briefing, is to make sure we have a voice and that we can talk to all the people out there.
Yeah. Thank you, Crystal. We are so grateful you and Greg and the team have made this space for this conversation. It's so important. Like you said, it's kind of overwhelming. There's so many measures. I put on my ballot, the whole first page were the bazillion governor candidates, right? Like we all saw that. We all know there are a lot. There's the judges, right? I was trying to go through all of those and understand the implications of each of those. Like we all felt it on our ballots. So I appreciate that you've just made the space for something that's really important, especially to the local community of South LA when it comes to Measure ER. So thank you, Crystal and Greg, for creating the conversation and facilitating it today.
Oh, you are so welcome. In fact, like I said, we had a guest she was there and she's like, okay, I need help. And so we're like, okay, we'll make time for you after the show. And we went through myself and Robin and Emma. We all talked to her for about an hour. And so she had some clarity. She felt very overwhelmed. And she said her parents were the ones that usually helped her do this stuff. And they were no longer with her, and she just felt lost. And so we get it. So, and I'm sure there's some people here that may have had some challenges as well. But yeah, that's why we're here. So anything that you guys need and need a platform, then we're here for you. So just ring us up. Y'all got Robin right there. So
I know.
Robin,
Yeah. Well,
I
for sure. I mean, I put the Dream Show link in the chat, so please take a look at it. There's segments that you can watch that are about 3 to 5 minutes long. And Rob is not on the call, but I would be remiss if I didn't share that the Dream Council is doing their the very first fundraising event at the Barbara Morrison Performing Arts Center in Leimert Park Village in August. And there's an in-person and also a live streaming option, but it's going to be a great event with live music, spoken word, artist performances, and the council is organizing this, and all proceeds will go to our hospital. So that is one way that we can get involved. I know this is high level. It's easy to get lost in the weeds and get frustrated, at least for me personally. But I find joy in finding ways that we can make a difference with your neighbor. And so I'll probably pop in on the platform in a month or two just to give you more details on that. But that's something that we all could be part of.
Oh, please, please, please do. I do have a couple things I want to post here. I got something from PCR. I think the making sure, and I'll find it. If not, I'll have to email it to you guys. That for FIFA, anybody that you know that are out there selling FIFA wool for the soccer team, make sure you understand what the copyrights are. Because I think based upon this email, as soon as I find the flyer, it's going to be pretty severe if you're infringing on copyright of products. So all of those teams actually do have copyright infringements. So we want to make sure everybody's aware of that. And I believe they're having a meeting, and I'm trying to find it. Okay, I will find it soon. So anyway, anyone have any questions before our guest leaves? Oh, here it is. I knew I was gonna find it. So guys, remember that pass this on, because and the same thing will happen when the Olympics come. We just can't just set up shop and start selling stuff on the corners. We have to go through the process. So, any questions? Was there any more questions? Greg, in the chat?
No, I didn't see any.
Okay.
You can set up shop in the corner. You just have to be able to run fast.
Say that again, Joseph.
I said you can set up shop on the corner and sell anything you want. You just have to be able to run fast.
Oh, I see. Well, you always, when you go to a concert and you're going like, how the heck did they get this done so quickly? It's like he's standing on the corner, or let there be some sort of crisis going. It's like, dang, they got the shirts out already? How did that happen? And I was coming from somewhere. I was coming from Pasadena, I think. And there was a concert or something at the SoFi, the stadium there. What's that stadium? It's the bank. It's a bank, right? Is that BMO's the stadium? Is that who that is? And people were walking up the freeway. They were up on the freeway because we couldn't get off on the exit, and they were selling shirts on the freeway. Like, what the hell? Jumping across traffic, and we trying to get off. It was insane. So anyway.
It's interesting. Those vendors have to pre-print. So if you have a game and you've got two teams, you got to print both as winners. Right?
Exactly.
So what do you do with the shirts of the losing team that they not champs?
So anyway, guys, thank you so much for joining us. Thank you, Sharon. Of course, I saw Tony just jump off.
Thank you, Sharon.
But know that if you, whatever you need, we're here. And so even as we go forward, this is your platform as well. Okay, so just know that. And next week, our guest is Mr. Joseph Duncan. He's going to come share his nuggets.
I'm already ready.
I know you're ready this week. Now that's a fan, Joseph. So we will see Joseph next weekend. And for you guys, have a great, safe weekend. It's a little crazy out there these days, so be careful.
Yep.
Out there. And so with that, guys, we're going to shut down today. And Renee, did you see that text I sent you? And Sherilyn, safe travels. Oh, there's Stephen. Hello, Stephen.
Yep, he's there. I got a jet. I got to head down to Irvine. So
okay, see you guys. I got to go to Norwalk to drop off my ballot. So I will see you all. We'll see you all next Thursday. Have a great weekend, guys.
I'll come back now here.
Yeah, please do. Bye-bye. Okay, still got to stop the recording before.